I started as a medical secretary, moved into the Navigator role, which was a brand new role, and I thought it would be a really good challenge for me. Essentially, the role was set up to support the CNS team for colorectal cancer patients. There's some patients that identified that they'd felt a little bit lost at sea after their diagnosis. So the Cancer Navigator role was brought in to support that with the Right by You package and holistic needs assessments. And patients have really appreciated it, responded to it really well. And it's just meant the service is just so much more improved. Whilst I didn't have to complete any additional qualifications before I started the role, it became apparent when I was in the role that I needed to do a little bit more around cancer treatments and listening skills, motivational interviewing and counselling skills, which has come in really handy. Macmillan have a learn zone and they funded a lot of the additional qualifications as I've gone on, and I'm looking to do a HOPE course coming up into the future, which is supporting patients as part of a stratified follow-up in helping them to learn to live with cancer and beyond cancer. A typical day for me would be to come in and look at clinic prep for those cancer patients coming into clinics, whether that be to be told bad news, also for those patients that are coming post-operatively. I would also chase any investigation scan reports so that they're readily available for the clinical teams, including the consultants. I'd also arrange specialised blood tests for if patients were going to go for chemotherapy. I'd also get the opportunity to go up onto the wards to see those patients and carry out something called a holistic needs assessment. And that would be signposting them to things like counselling or benefit support. So it's a really valuable tool that we use in order to help patients more holistically. Professionally, I bring to the role a great set of organisational skills, which have come from my medical secretarial background. I also have quite a range of knowledge across all directorates, really, from dermatology to haematology, which comes in handy when you're looking at lab reports. So an understanding really of some of the terminology. I used to teach medical terminology, so that's been really useful. And actually, I suppose as a layperson, being able to translate some of the technical terms into lay terms for the patients and their families. On a personal level, I have had a history of cancer myself. I've found that the amount of empathy that I can offer is really genuine and sincere. The thing I enjoy most about my role is completing a holistic needs assessment with a patient. It takes them through 4 different categories, gets them to think about how they're coping physically, mentally, if they're coping financially or spiritually, and they can identify any worries. I can pick up on those and then signpost them in the direction of help and support elsewhere, whilst the holistic needs assessment is very much patient orientated. It actually works to the value of the clinical nurse specialist team too, because they can change their plans to suit the patient. Leadership to me means support, guidance and encouragement. My role was one of the first Navigator roles in the trust, and there have been quite a few that have come behind me. And I find that I've been able to be a mentor to those navigators and able to encourage them and support them in building their service and bridging the gaps for their patients and their clinical teams. If anybody else was interested in finding out any more information about the role, I'd definitely recommend they go and talk to the local Macmillan Information Centre, and there's usually one in each hospital. Failing that, there'll be a cancer business unit, and just go and find out who the lead cancer nurse is, and they'll be able to give them some more information. I wouldn't think twice about suggesting this role to anybody. I think you have to be organised, very flexible and adaptable in the role. I think if you are interested in helping people and making a difference, then this role is definitely for you.